Hi everyone, it's Dr. Sarah Moore here, and today I have the pleasure of speaking with Beck Clayton. So Beck is a women's physio specialist down in Margaret River, so welcome back.
Thanks, Sarah.
So Beck,
Thanks for having me.
pleasure. Thanks for making yourself available. So Beck, I thought today it would be really helpful for us to have a bit of a chat about the work that you do as a women's physio, particularly with women during their pregnancy and the postpartum. So could you tell us a little bit about the changes that happen to the pelvic floor during pregnancy, childbirth, and after the baby's born?
Yeah, absolutely. So during pregnancy, increased uterine size, increased body weight puts more pressure on the pelvic floor or more load on the pelvic floor and more pressure on the bladder and bowel. Relaxin hormone, which is so important for every other stage, but it affects the ligaments, the muscles, including your pelvic floor muscles, which ends up decreasing support and also causes the sphincters that control the bladder and bowel to become more relaxed. Low estrogen levels as well can cause irritation of the lining of the bladder or the urethra and the vagina, which can cause bladder urgency, having to go frequently to the toilet, and also leakage with coughing, sneezing, lifting, laughing, those types of issues.
Mm-hmm.
During pregnancy as well, constipation is so common. So all those hormones can make the gut less efficient. There's increased pressure from the growing uterus on the bowel, which can slow down. Iron tablets or iron supplements are a huge cause of constipation, and also decreased exercise, particularly in the kind of second and third trimester. During pregnancy, so I didn't bring my pelvic floor model. I really should have in hindsight, but that's okay. The pelvic floor muscles actually stretch almost 4 times larger, which can result in the risk of overstretching those muscles, so pelvic floor muscle trauma. Specific risk factors, and that's obviously for a vaginal delivery. Specific risk factors for that are a big baby, so babies weighing more than 4 kilos, big head circumference, so more than about, say, 35, I think it's 35.5 centimetres, forceps delivery, and some other factors. The nerves supplying the pelvic floor muscles can be overstretched. They can be compressed, and a lot of women might find after a delivery, one side of the perineum or when they're washing and wiping down there, it's a bit numb or there's decreased sensation there. Most of the time, natural recovery happens over months, and about majority of people are normal at kind of 6 months postpartum. Pelvic organ prolapse as well can happen during delivery. So pelvic organ prolapse is the descent of one or more of the pelvic organs, so that could be the bladder, the uterus, or the bowel, into the vagina or beyond the vaginal opening. Okay, which sounds really scary. Don't go and Google it. It's so common. There's heaps pelvic floor muscle training can do to help. There can be damage to the bladder during childbirth, urinary retention or not being able to empty the bladder completely. From having, say, a forceps delivery or a cesarean, the bladder can be bruised, and so it's not quite getting that normal sensation or that effectiveness to empty completely. It can be overstretched, and also from having, say, an epidural or a catheter in as well, that sensation is not completely normal. And the other thing that can happen during childbirth, and again for a vaginal delivery, is you can have a tear, so obstetric tears. They're graded from a 1st degree right through to a 4th, and certainly 3rd and 4th degrees are associated with having bowel leakage or bowel incontinence, or also when your obstetrician might cut, which is called an episiotomy, which can affect those pelvic floor muscles. Following childbirth, caring for a newborn baby, plus or minus another toddler at home, can make it really difficult to find time to rest and recover and find time to exercise, and leading to quite a poor routine. Reduced fluid intake, potentially poor diet as well, can increase the risk of constipation, which we know is a risk factor for having pelvic floor muscle dysfunctional issues. And also breastfeeding results in estrogen suppression. So that's associated with, again, bladder urgency, having to go really frequently, and also stress urinary incontinence, leakage with coughing, sneezing, lifting, laughing. Mm-hmm. Hopefully I haven't scared you too much.
Well, no, I think it's really really important because I
Yeah.
think a lot of women do experience these issues and they
Yeah.
just think that they have to put up with them, that it's normal, that, that there's not much that can be done. And I think that's why it was, I thought it would be really helpful for us to have this conversation today so women understand that there is a lot that can be done to both prevent and also, help with recovery from these issues. So then you talked a little bit about bladder and bowel incontinence and also prolapse. I'd like to sort of delve into that a little bit more. So can you talk a little bit about how common they are and perhaps then go on to talk about the evidence for managing that with pelvic floor muscle training?
Yeah, so it's quite difficult to kind of ascertain the exact prevalence or incidence of bladder and bowel incontinence and also prolapse, just because there's such varying degrees. I think it's probably underreported, but certainly the Continence Foundation of Australia has found that almost about 30% of women in the 3 months after delivery or postpartum experience bladder leakage or urinary incontinence. Stress urinary incontinence, which is leaking urine when you cough, sneeze, lip, laugh, is the most common, and about 30% of women after a vaginal delivery experience that. That the vaginal delivery doubles the risk of experiencing that. So about 30% in vaginal deliveries, 15% in caesarean deliveries. In regards to bowel incontinence or fecal incontinence, it's sometimes called, about 29% of women in the first 3 months after vaginal delivery experience bowel leakage. Now that can range, it could be loss of control of wind, it could be loss of control, like a smear on your underwear, quite a runny stool or a form stool. So there's different degrees. And certainly having forceps delivery, or as I said earlier, a 3rd or 4th degree tear are considered the biggest risk factors for having bowel leakage or bowel incontinence. Prolapse, again, really tricky. I couldn't find any evidence postpartum with the incidence rates, but up to about 50% of women, and this is women throughout the lifespan, who've had a vaginal delivery or had a baby, experience some degree of pelvic organ prolapse. And that's a range. So there's different stages of prolapse, varying from a stage 0, nothing at all the way through to a stage 4, okay, which is considered the most severe prolapse. In WA, they think there's about a 19% chance of having surgery for pelvic organ prolapse. So it's quite significant. And no one talks about it, which is so important to talk about.
Absolutely. So I guess
that's a nice little.
Sorry, what was that, Beck?
Oh, I was just going to say that kind of brings me into the evidence, but sorry, Sarah.
Yeah, no, well, I was going to just, recap that question. So, please continue.
So first, there's fantastic evidence for pelvic floor muscle training for bladder incontinence, bowel incontinence, and prolapse, which is just fantastic. I think part of it is educating people that the evidence is now there. The best thing about it too, it's conservative. It doesn't involve surgery. It can take time, so your results aren't going to happen overnight. So generally, I recommend about 3 to 6 months trial of intensive physio-led pelvic floor muscle training before kind of considering other options, and that's usually in liaison with an obstetrician, a gynecologist, and whatnot. So for first-time mothers, there's first-time mothers who do intense supervised pelvic floor muscle training led by a health professional experience less urinary incontinence in the 3rd trimester and also postpartum. So all mothers, continent mothers included, should be recommended to do pelvic floor muscle training antenatally, and that can reduce their urinary incontinence postpartum. And that's level 1 evidence, which is the highest level of evidence there is, which is just fantastic. Postpartum women, so there's first pelvic floor muscle training is recommended as first-line therapy for women in the postpartum period experiencing urinary incontinence. Again, really fantastic. For prolapse, pelvic floor muscle training can reduce prolapse severity and symptoms, and that's a level 1 evidence again, so the highest level of evidence there is. When we come to bowel incontinence, pelvic floor muscle training is recommended alongside lifestyle education and dietary advice for bowel incontinence or bowel leakage. That's not quite as high evidence as for bladder leakage and also prolapse, but it's a level 2 evidence, so it's still worthwhile trying for those things. And I would say with most cases with these women, I see a significant reduction in their symptoms.
Yeah. And no doubt other improvements. I mean, any sort of lifestyle measures that you're making for one system often have benefits for other systems as well. Being, human beings, we're a whole a whole creation, and so it's often, they pay off in multiple ways, which is always nice to see. Fantastic, Beck. And so what are some of the so can you just actually run us through a little bit about what you do when you see a woman for the first time, perhaps when she's pregnant, but often you probably see them for the first time postpartum?
Yeah. So usually when I see a pregnant woman or a postnatal woman with pelvic floor muscle concerns, I spend about an hour for the initial appointment, just because I go through questions about general health, past obstetric history, past surgical history, and then into some more specific questions about bladder and bowel. They're very, very much interrelated, particularly, I'll talk about it in a while, about constipation and straining. So following that, I kind of identify what might be going on, what's causing these symptoms, and then we'll go into pelvic floor muscle assessment. So generally for antenatal women or pregnant women, I'll assess the pelvic floor via real-time ultrasound, where basically, I don't have it with me unfortunately, but I pop a probe. It's very similar actually to your obstetric scans. Pop a probe just on your lower abdominals and see the bladder and the pelvic floor underneath. And it's a great way for women to be able to see, okay, how do I contract and actually activate the pelvic floor correctly? Plus relaxation. It is so important to be able to relax the pelvic floor muscles, particularly if you're planning a vaginal delivery. And I think most people forget that.
Absolutely.
So that's one in terms of assessment. I also do vaginal examinations. That's quite different, and generally I don't do them with antenatal women. It's most common with postpartum women. It's different to a pap smear in that I just use 1 or 2 glove fingers inserted into the vagina to assess the pelvic floor muscles. I can assess the prolapse, but then I'm really interested in the muscles, so how strong they are, how long you can hold for, how well you're relaxing, and then individualize and kind of a supervised pelvic floor program for you to take away and practice on.
Fantastic. Well, that's really helpful to know, Beck. And I think a lot of women can feel a little bit daunted about going to see a physio, knowing that there's an examination involved. But as you say, I think particularly the ultrasound is so valuable, because you can make that connection between what you're feeling and what's actually happening, and being able to see that can be such a helpful way of moving forward, which is great.
Sorry, Sarah. Something I should say too is that the ultrasound allows us to assess your pelvic floor muscles in different positions. So, most commonly people might find it's quite easy to do pelvic laying down on your back, but a lot of the time you don't get bladder leakage, bowel leakage, prolapse symptoms laying down. So with the ultrasound, you can actually say, well, let's try standing and see those muscles working, or even walking or integrating with abdominal exercises, that type of thing.
Absolutely. Yeah, such a fantastic tool.
It's very good.
Yeah. So, Beck, I mean, unless you've got anything else that you specifically wanted to mention, I just thought we'd close up, and you could give us probably your top 3 tips for, really caring for your pelvic floor during pregnancy and postpartum.
Yeah, absolutely. So probably the biggest thing I would say is, given that constipation is so common, and if you're constipated, you're more likely to strain, which are both considered, well, the evidence supports them as really significant risk factors practice for having pelvic floor problems. So avoiding constipation and straining. If you're getting any signs of constipation, speak with your GP obstetrician. You could come see a pelvic floor physio for some dietary advice around that. Sometimes some soluble fibre might help, and in some cases laxatives are required, and that's absolutely okay because there's some really safe, good evidence-based laxatives now that are safe to use during pregnancy and in the postpartum period. Also really important to adopt a good toilet position to help avoid straining and also allow you to evacuate the bowels completely. So I don't have it here. I was so unorganised. Basically, a lot of people suggest, and I would certainly suggest using a footstool when you're trying to do a poo, which means that your knees are higher than your hips, which can just really optimise that evacuation position, and then a bit of a forward lean position. But if you're having any difficulties with that, you're feeling like you're not evacuating, straining, or just cannot get on top of your bowels, certainly, have a chat with your GP obstetricians there or a pelvic floor physiotherapist. The other things I'd suggest are pelvic floor muscle training. So as I said, there is really good evidence for pelvic floor muscle training in the antenatal and the postnatal period. The program does need to be individualised. It does need to be intensive. So by doing a program that your friend's doing might not necessarily work for you. Control is important. So being able to contract when you cough, sneeze, lift, laugh, those types of activities, but being able to relax when you do a wee, when you do it. So as well as being able to contract the pelvic floor when you cough, sneeze, lift, blah, it's also really important to be able to let go or relax your pelvic floor when you're doing a wee, when you're doing a poo, and for sexual intercourse. So that control is really, really important. It's also important to do the recommended training dose. So the evidence suggests that 30 pelvic floor muscle contractions a day are effective in reducing bladder leakage, bowel leakage, prolapse symptoms. If you're doing less than 30, you can't really expect to have a result. But then again, no need to go above and beyond 30. They used to think it was about 300 a day, which is just incredible. So 30 is very achievable.
Absolutely.
The other thing I'd suggest is using your pelvic floor in action. So when you're lifting, when you're coughing, contracting the pelvic floor to help provide support to the bladder and bowel and also the pelvic floor organs. And as well as looking after your pelvic floor, you want to avoid things that can damage or weaken the pelvic floor. So that would be constipation, straining. It might be high impact physical activity. When I say high impact physical activity, that's more like trampolining, gymnasts, heavy weights, that type of exercise, lots of abdominal exercise. And finally, my third tip would be, as I said, avoid activities that might weaken your pelvic floor. So for example, activities that are too challenging, lots and lots of sit-ups, bridges, double leg work, planks, that type of thing. The reason for that is your abdominal muscles, which are a lot stronger, a lot bigger than your pelvic floor muscles sitting at the base of the pelvis, can override the pelvic floor. So it creates excessive downward pressure on the pelvic floor. And if you're experiencing pelvic floor concerns, such as bladder incontinence, bowel incontinence, prolapse, you've got to train the pelvic floor first. And it's not that those activities potentially will make your pelvic floor problems worse. They might just not result in you getting over them completely. And there'd be my 3 tips.
Fabulous.
Yeah.
Thank you so much, Beck. There's so much wisdom there that you've shared with us today, and I'm so grateful that you could, put some time aside to share that. So I'm sure you'll, I know you're already busy, but I think you're going to be becoming a lot more busier. I just think it's such an important preventative activity, looking after your pelvic floor, and it saves a lot of grief down the track. Certainly, as women approach menopause, a lot of these issues can become a lot more significant. But so by doing the work now and investing the time, it can save a lot of issues in the future. So thanks so much again. Any closing comments?
actually, one thing, as you said with menopause, age is completely no barrier to improving your pelvic floor function. So that's just something to take away. You're never too old to actually improve that.
Excellent.
Thank you so much for having me.
It's been a pleasure. Thank you so much for joining me. And okay, enjoy the rest of your day.
Thank you too, Sarah.